Hello, and thanks for joining us. Today I'll be speaking about calcium and magnesium macromineral nutrition. My name is Neil Edward Levin. I'm a clinical nutritionist and one of the founders of the American Nutrition Association and a supporter of the NHRI, the Natural Health Research Institute. You might recognize on this slide some of the categories that you will find on the periodic table of elements. And in fact, these minerals are mineral elements. For example, calcium is an element, sulfur is an element, iron is an element, potassium is an element. And when we use them as nutrients, they often come in compounds rather than as single elements. And those are the mineral nutrients that we will be talking about. So mineral nutrients, also known as dietary elements or dietary minerals, are inorganic substances. They're often referred to as minerals, but as I mentioned, they also are elements in their single isolated forms, but they don't typically occur in isolated forms in nature. They tend to occur in compounds, and some of those are organic, or in other words, carbon-based, and others are not. So there's four basic elements: oxygen, hydrogen, nitrogen, and carbon, that are required by living cells and organisms. But we also require specific additional minerals, and we're going to talk about those today. So here is one version of the periodic table, very useful. And calcium, magnesium, as you see, are in the same category on the left, where I highlight them with the blue line around them. And they're considered alkaline earth minerals. So those and other mineral elements are naturally present on our planet. They're found in soil, water, and foods. Plants tend to get them from the soil, and in fact, the minerals from the soil are the main nutrients for plants. Animals obtain them because we eat plants, we eat animals, not all of us, but many of us eat animals. And we also get them through drinking water or other sources. Now we know that the mineral content in local soil and water is going to vary, and modern food processing often robs our foods not only of vitamins, but of minerals. So supplementation is one alternative if we can't ensure adequate intake of these essential nutrients from the diet. And it's also been viewed as kind of like an insurance policy, that we can better guarantee that we're going to get the minimal levels, at least, of essential nutrients such as these minerals by supplementing them. Mineral nutrients are required for skeletal structure, bones, and teeth, but they're also have many, many other functions in the body. They're essential components of our tissues and fluids. The body enzyme systems usually have mineral cofactors. Almost every function of our bodies is dependent on having these minerals as part of our diet, whether from food or supplements. So let's look at some of the complexes that are available, because as I mentioned, minerals do not occur in nature as isolated elements. They occur in complexes. So one concept that's very important when we're looking at supplementing is the pre-acidified or chelated forms. And chelate is the Greek word for claw, so it implies a bonding or an attachment between the element and some other substance. And the pre-acidified ones are complex, combined, reacted to various acids in foods. So the pre-acidified forms are less alkaline but they're also more dilute than some of the cruder forms, such as the carbonates. And I do have a chart I'll show you later that's showing the percentages of the elements that are in different kinds of complexes. Now, any mineral that's bonded to a carbonate tends to be a strong antacid. It tends to be a mineral that is in an alkaline complex. It is, if you do a pH reading on it, it's going to be a high number, higher than 7.0, which is indicator of a neutral pH. So chelated forms are more bioavailable typically than other mineral complexes. And the way it's done is they're combined with what are called weak acids. There's other terms for them, but typically food acids. We'll go over some of them in a few minutes. The chelated forms are considered pre-digested, and they're typically pre-acidified, so they don't require digestion to attach acids to them in the body. The chelation tends to increase solubility, so they can be absorbed. Even people who have poor stomach acid, who might have difficulty absorbing minerals and other nutrients, will tend to absorb them better if you have a pre-digested form, a chelated form. And the other advantage of a chelated form is you can take them between or with meals, and it doesn't affect them so much because they're already digested. So carbonate is one of the common forms in the diet and in supplementation. One of the reasons why is because minerals like calcium, magnesium can be bonded to carbonic acid to form carbonates. So the element carbon is attached to them. And in nature, minerals occur in compounds, but the compounds are not all pre-acidified, pre-digested. Many of these are in the forms of, for example, calcium carbonate, magnesium carbonate. These are alkaline substances. They're found in rock powders. For example, dolomite was a supplement when I started in this industry in 1973. Oyster shell and dolomite, which were both calcium carbonates, were common supplement powders at the time. Coral calcium is another one that's based on calcium carbonate, but contains a number of other elements and trace minerals, and in fact is even more alkaline than regular calcium carbonate because of these other compounds. The carbonate, as I mentioned, is a historical source of dietary minerals, but they are alkaline. They're not pre-acidified, they're not pre-digested, so they work best if you get adequate stomach acid for digestion. And if you take them with food, the acids in the food can form chelates in the stomach during digestion. So the supplements we sell that are pre-digested, pre-acidified kind of mimic what should be happening in a healthy digestive system. And you're getting the similar forms. Now, citrate is a form that is better regarded nowadays and is very popular, where the mineral like calcium is bonded to citric acid to make a citrate, or magnesium bonded to citric acid makes magnesium citrate. It's very popular. It is no longer alkaline. You have now more or less neutralized the pH. You do not require stomach acid to tear apart the calcium from the carbonate, for example, and reattach the calcium to an acid. And because of that, it doesn't require stomach acid. You can take them between meals. It works just as well. The malate is another form. Malic acid is an acid that is found in apples, for example. And it's often combined with citrate. So citrate malate is popular because there have been some studies on that combination form where 2 different acids have been combined with the calcium, for example, calcium citrate malate. So malate is a popular source of minerals, especially for magnesium. Once it's chelated, it's non-acidic, pre-acidified, pre-digested, so can be taken again between meals, with or without meals, because it does not require stomach acid. Now, gluconate is a form that kind of an old school form. A lot of the capsules and tablets used to be as gluconates in the past as the chelated form. Nowadays, we have the citrates and other forms that are probably more advanced, but similar. Really, the main one you'll find as a gluconate nowadays is potassium. And again, it has the similar properties to the other chelates: non-alkaline, pre-acidified, pre-digested, take with or without meals. Glycinate is bonded to a different acid, an amino acid, the amino acid glycine. It is very common as a source of dietary minerals. Magnesium glycinate is one of the more popular, and it's often in the form of bisglycinate, which simply means there's 2 glycine molecules for 1 magnesium molecule in that compound. So again, it's non-alkaline, pre-acidified, pre-digested, don't need stomach acid, with or without meals. And additional forms include aspartates, lactates, oxides, chlorides, ascorbates, and picolinates. And the form has an effect on absorption of the mineral and bioavailability, but also efficacy, because it kind of depends on the target site. The type of substance that's attached to the mineral, it can be a functional method to deliver that nutrient to a target tissue. For example, binding magnesium to the amino acid taurine tends to target the heart and the nervous system, so are considered especially potentially valuable for those systems and those functions. Now, I mentioned these are chelated forms. Oxides, for example, and chlorides are not typically made. They're typically found in nature. And the oxide is considered not so good typically, which we're going to actually explore in a few minutes, whether it really is as poorly absorbed and not as good as you would expect from some of these descriptions on the internet, or people who are making their opinions known about various forms. The chart I show you later will actually show you what experimental data indicates is the actual bioavailability of these forms. But aspartates, lactates, ascorbates, picolinates, taurinates, the other forms I showed you earlier, the citrates and malates, for example, and glycinates, they are, most of these are manufactured. They're semi-synthetic in a sense, but they mimic what would happen during digestion. But the oxides and chlorides tend to be from nature and have different properties. So let's look specifically at calcium. It's used for skeletal and dental structures, but also clotting, endocrine function, making hormones and signaling between cells in the body. We cannot produce calcium, so we obtain it from the diet. It's also used for muscles being able to clench. You know, there's a large number of functions of calcium in the body. And our bones and teeth are continually involved in a process of absorbing and utilizing calcium and then breaking it down and reabsorbing it. the accumulation of calcium is greater during our youthful period. Later in life, the resorption, the breakdown, and loss of calcium tends to outpace the deposits of calcium that are going into appropriate tissues, such as bones or muscles. And bone loss and health concerns can be a problem. Optimum dietary intake can offset this imbalance. One thing to consider is how your diet is in terms of providing calcium and cofactors, and I have another chart later. We'll explore that a little more. There are some health claims for calcium that you will see on product labels, and these are regulated by the Food and Drug Administration, the FDA. The recommended intake varies from 200 milligrams a day for young infants to 1,300 milligram a day for pregnant and breastfeeding teens and children who are still accumulating calcium. And you're actually allowed to make some health claims for calcium, vitamin D, and osteoporosis, for example. The FDA has determined that these claims meet a standard of being in scientific agreement, that there's a scientific consensus that these are accurate. So here are some model claims that are presented by the FDA. Adequate calcium throughout life as part of a well-balanced diet may reduce the risk of osteoporosis, and adequate calcium as part of a healthful diet along with physical activity may reduce the risk of osteoporosis in later life. These are a couple of examples that the FDA provides of the kind of claims that they will accept as justified by scientific evidence. There's also a category called qualified health claims, where the FDA will not object if you use certain claims. For example, calcium supplements may reduce the risk of hypertension, but it's qualified as being said some evidence suggests that it may reduce the risk of hypertension, and the FDA has determined that the evidence is inconsistent and not conclusive. So in other words, if you put enough disclaimers in, you can make a claim because there is some evidence to support this claim. There's also claims for calcium and vitamin D, and this is another authorized claim that is meeting that standard of significant scientific agreement or consensus. Adequate calcium and vitamin D throughout life as part of a well-balanced diet may reduce the risk of osteoporosis, or a similar one that's a little longer, just showing that these are claims you can put on a label and there will be no objection or enforcement action by the FDA. So let's look at some of the calcium forms. And here's one of those charts I was promising you. And for example, you'll often see calcium carbonate in supplements because the level of calcium, the percentage of calcium in calcium carbonate is about 40%. If you take a different form, for example, the calcium ascorbate is about 9 or 10% elemental calcium is the way that's described. The rest is vitamin C. Calcium carbonate, 40% approximately is calcium and about 60% is carbonic acid. On the citrates, there's about 21% elemental calcium and about 79% citric acid. So you can see that there's quite varying percentages between 9% and 40% of calcium supplement may be calcium. But if we look at the absorption rate to the right, we're looking at calcium carbonate absorbed at an average of 26% in human studies, and calcium citrate at an average of 22%. So you've got twice as much calcium roughly in calcium carbonate as calcium citrate by weight. So if you took a gram of calcium carbonate, you'd have about 400 milligrams of calcium. If you took a gram of calcium citrate, you'd have about 210 milligrams of calcium, about half. But when you look at the absorption rate, it ranges from 22% for citrate and 26% typically on the carbonate. So you have slightly better absorption on the carbonate and twice as much calcium. So you take half as many pills. So that's one reason why carbonate is still somewhat popular. Now, the comment on the right indicates that calcium carbonate is not soluble at a neutral pH. It needs the stomach acid to absorb, and that's why there's such a wide absorption range from 13.8 to 64% absorption, because it absorbs really well if you have good stomach acid and take it with a meal. If you don't have good stomach acid and you don't take it with a meal, your absorption rate goes way down. Now, there's a much narrower range of absorption, bioavailability, for calcium citrate because it is soluble, and you're getting between 12.3 and 31.4% absorption. So if you have good stomach acid, you can actually absorb calcium carbonate twice as well as calcium citrate, according to these the number from these data. So that indicates how complicated this becomes, trying to choose which calcium supplement may be right for you or right for your patients if you're a doctor, or your clients if you're a nutritionist. So there's a number of forms here, and milk protein, milk calcium, I should say, is about 33% absorbed, so it absorbs pretty well. That's in the form of calcium lactate, and calcium lactate is a low percentage of calcium compared to calcium carbonate or citrate, and is not commonly used as a supplement these days because you have to take more pills or more powder to get the same amount of calcium. And we can see that some of the other forms like bone meal, dolomite, oyster shell, all typically in the 20 to 30% range for these. So you can get different amounts of calcium in a product that require different serving sizes. But the other consideration is how good is your stomach acid? Are you taking it with meals and it's not neutralizing your stomach acid? You have adequate stomach acid to properly digest. And then all bets are off. Most of these calcium forms are going to work pretty well in someone who's got good stomach acid. Some of them will not work very well at all if you don't. Now, calcium carbonate should be taken with food or immediately after eating. It's absorbed more effectively if there's food in the stomach. But the pre-acidified forms, as mentioned earlier, are well absorbed at any time. Make sure there's plenty of water, and the most you could absorb at one time is about 500 milligrams of elemental calcium. So when you're looking at a product label, how do you know what elemental calcium is? Well, the calcium is always called out separately from the compound. So if you see something that's giving you 2 or 3 or 4 pills give you 1,000 milligrams of calcium from calcium carbonate, from calcium citrate, there's much more of the other material in there. As shown in that previous slide, calcium citrate is about 20% roughly calcium, elemental calcium. So you're taking 5 times as much, approximately, of the compound of calcium citrate as you would to get that amount. If you want to get a gram of calcium, you have to take about 2 grams of calcium carbonate, a little over 2 grams. But you have to take about 5 grams of calcium citrate to get the same amount of calcium. If you have something that's got more calcium in it inherently, the percentage of calcium in the compound is higher, you take fewer pills or less powder to get the same amount of calcium. And that's what this chart indicates. That if something is 40% calcium versus 10% calcium, you take a lot less of the 40% than the 10% to get the same amount of calcium. So some of the forms you will find as these calcium chelates that are pre-acidified, pre-digested, calcium citrate, calcium malate, calcium citrate malate, which might be more common than calcium malate. Calcium amino acid chelate, which could be specific amino acids like glycinate. Calcium gluconate and calcium ascorbate are all forms you can find in supplements. Now, there's another form that I really like formulating with, and it's called Aquamin. It's a red mineral algae that's harvested off the coast of Iceland in the North Atlantic. It's actually processed in Southern Ireland, and it's a rich source of calcium. It also has magnesium and 72 trace minerals. So it works a little differently than some of the other calcium products because it's a food source. They're actually taking the skeleton of seaweeds and processing that. So the calcium-rich parts of the plant. Now, unlike normal calcium carbonate, there's a different structure that's more of a honeycomb. So it's different from calcium carbonate that would occur in rock powders because this is taken from a plant. So it has advantages in terms of absorption, in terms of magnesium and trace mineral content in the Aquamin. So we want to maintain our bone structure and strength. We want to maintain healthy bone density. We need to aid the mineralization and maturation of bone cells. And Aquamin and vitamin D have a proven synergy in support of bone mineralization. And certainly it fits with the FDA claims that we talked about earlier about taking calcium with vitamin D and the potential benefits. So in this study published in Nutrition Journal, we see that someone who's taking the Aquamin has a greater ability to walk farther if they're somewhat have difficulty walking versus taking other supplements that don't work as well. For example, glucosamine or placebo. And magnesium is another important mineral, the other main focus of this presentation. It's another mineral that's found in the human body. Both minerals are involved in skeletal health. Magnesium has been credited with being essential for over 300 biochemical processes in the body. The latest number I've seen is about 360 that have been discovered so far. Essential for cardiovascular function, immune function, muscle function, fat metabolism, enzyme production, energy production in the body are just some of them. And in the Journal of the American College of Nutrition, it was reported that higher magnesium intake from both diet and supplements is associated with a 27% lower risk of developing metabolic syndrome in healthy women. Metabolic syndrome is a cluster of symptoms that increases the risk for diabetes, heart disease, and non-alcoholic fatty liver disease. So having those symptoms is not considered a healthy sign and are in fact considered risk factors for developing these diseases. So here's a similar chart that I created for the calcium, showing some of the magnesium formulas. And you can see there's different forms similar to what we saw for calcium. There's ascorbate and carbonate and citrate and glycinate and malate and oxide. A couple other forms, the threonate and the taurinate, a couple of amino acid chelates bonded to amino acids. And you can see that the specification, which is the amount of elemental magnesium in a compound, how much of a compound, for example, magnesium ascorbate, is magnesium, and how much of that compound is vitamin C, ascorbate. And as we see, about 7% of magnesium ascorbate is magnesium, and it's about 93% vitamin C. On the citrate, you're looking at about 16% elemental magnesium in a compound. And on the glycinate, 14%. You're usually looking in the range of roughly 10 to 20% for most chelated minerals. If you're looking at magnesium oxide, which is a form that's been used for many, many years and is typically extracted from seawater, 60% elemental magnesium. So if you want to make a claim, you can get 400 milligrams of magnesium in one capsule. You're almost always going to have it be in the form of magnesium oxide, because that's the one that has the most magnesium per weight unit, per serving. So if you took something that was 16% elemental, like magnesium citrate, that's only about roughly 25% as strong in terms of magnesium content as magnesium oxide. In other words, you have to take nearly 4 times as much of a citrate to get the same weight of magnesium as magnesium oxide would have. Absorption rates, we don't have a lot of information on there. We know the oxide and the glycinate, which are both forms that you find in supplements, have similar absorption rates. But we see on magnesium oxide, again, it's insoluble in water, but it's about almost half soluble in acid. It requires stomach acid to digest the magnesium oxide, not so for the magnesium glycinate. But with similar absorption rates and almost 4 times the magnesium in magnesium oxide for some people might be a better supplement choice because they have to take fewer pills, and if they have good stomach acid, they'll probably absorb it pretty well. People do call and write to me and ask, why should there be magnesium oxide in this supplement? Isn't it poorly absorbed? And the fact is, according to studies, it is bioavailable. It is bioavailable for most people. It simply requires good stomach acid, which we should have anyway. That's part of our digestion. That's part of our immune system. So having adequate stomach acid is kind of a prerequisite for having healthy digestion and immune support, being able to sterilize things coming in through the mouth. And vitamin D is important as a cofactor, and it's found typically if you eat the livers of fish. So you're talking about small fish or whole fish, not fish fillets. It would be in eggs if the animals are going outside and getting sunlight and eating bugs and things like that, if they're free range. It could be in cheese, possibly as fortified milk, fortified foods, mushrooms. I've seen claims for vitamin D on mushrooms, but they have to be grown under ultraviolet lights or exposed to UVB rays from either lamps or sunlight in order to develop the vitamin D in there. It's similar to how our skin can make vitamin D from the sunlight having ultraviolet rays that react on the cholesterol in our skin and produce vitamin D. So fortified foods, some natural foods like fish liver oil or mushrooms or sunlight are really the main sources of vitamin D. And it's kind of unusual to have 3 sources, including sunlight, to make vitamin D, to make a vitamin, in fact, where vitamins typically have to be consumed orally. So that makes vitamin D unique because we can synthesize it. It is not only available from the diet. And there are subsequent conversions in the liver and the kidneys to make the hormones and the things that vitamin D really is intended as a precursor of. Now, we can't always make vitamin D. The farther north or south you get away from the equator, the more difficult it is to make vitamin D. Darker skin pigmentation could take 2 or 3 times as long exposure to sunlight before vitamin D is made. Winter months, if you are north of a line, say between Atlanta and LA, there's probably close to 6 months of the year you cannot make vitamin D because the sun is at too low of an angle. Many people avoid the sun, including covering up or using sunblocks. And this is especially true in Florida, Texas, Hawaii, where you would be surprised by the people in southern areas that have vitamin D deficiencies because they're avoiding the sun during the heat of the day. And scar tissue is another consideration. This sunshine calculator from the Vitamin D Council shows you if you find your position on the map and you look across at the horizontal line, if you see the reddish circles, that's when you can make the most vitamin D in those months. So say, take the one from New York, the June, July, August, you can make the most vitamin D. In March, April, May, and September, October, November, December, and September, October, you can make vitamin D, but only at certain times of day. And between November and February, you cannot make any vitamin D. The sun is at too low an angle. And in fact, I looked it up for Chicago, where I live, and the time you can make vitamin D because the sun's at a high enough angle is only between late March and late September. And outside of that window, it's not possible to make vitamin D because the sun is too low in the sky. And if you look at the right, the shadow rule, if your shadow is longer than your height, than how tall you are, you cannot make vitamin D. So the sun has to be at least 45-degree angle or higher in the sky, or else too much of the ultraviolet rays get filtered and you can't make vitamin D. So if you're in the months when you have the reddish area, intense sunshine, it takes 10 minutes for light-skinned people, 45 minutes for dark-skinned people to make your vitamin D, which is looking at 400 to 600 IU, not a huge amount. Moderate sunshine, it takes twice as long typically for the orange. So it's important to know that look at your shadow. If your shadow is longer than your height, you can't make vitamin D. If it's too cloudy, you can't make vitamin D. If you have dark pigments in your skin, which is one reason why you tan when you're in the sun, to prevent you from overdosing on solar-produced vitamin D, the pigments in the skin block that as well. So oily fish tend to contain vitamin D, especially the small ones where you're eating the livers. Some oils from fish, cod liver oil has it, but not normal omega-3 fish oil. Wild-caught salmon has a lot more than farm-raised salmon. And vitamin D is involved not only in calcium and bone metabolism, but cellular growth and differentiation, immune function. There's a number of different benefits. And in fact, the European Food Safety Agency recognizes several additional benefits for vitamin D beyond bone and dental health, which are the benefits that the FDA recognizes and that the RDAs are built on. So the American Journal of Clinical Nutrition reports that experts typically agree that if you don't get adequate sun exposure, 800 to 1,000 IU of vitamin D per day is needed. That is higher than the 600 IU that is typically recommended by public health authorities because they're restricting their potential benefits to bone and dental health. If people are dark-skinned, veiled, institutionalized, elderly, they might benefit by taking at least 800 units a day without testing. And if there's fat malabsorption, obesity, or other issues, people might need even more vitamin D. And vitamin K, the other main cofactor for calcium and magnesium. Vitamin D helps you absorb calcium, but vitamin K helps it be transported to where it's going. Is it going to the bones? Is it going to the teeth? Is it going out of the arteries and to these tissues? That's vitamin K's role, not vitamin D's role. So vitamin K does help maintain healthy bone mineral density. Vitamin K and D work synergistically on bone density by sharing the work of absorption and transport. 80 micrograms a day is the RDA, but 90% of dietary vitamin K is in the form of K1. 10% is in K2, which is found in fermented foods. They're both effective in clinical trials, and they're both in the food supply. But MK4 is your common form of vitamin K2. There's another form called MK7 that's extracted traditionally from fermented soy, a food called natto, but also can be in fermented chickpeas or garbanzo beans. It works by increasing tissue levels of MK4, and it helps with protecting to maintain the bone density and getting calcium out of the arteries and into the tissues where it belongs. And this chart is from a study showing comparison of K1 and MK7 with MK4. And if you look at the black line, the area under the curve is MK7. The area under the curve is much more area than the area under the curve for the red or the green indicated supplements. The green is MK4 and the red is K1. So the absorption is dramatically better and the area under the curve is much larger for MK7. Its half-life is also longer. You can see from this chart that the half-life is indicated as much more as well. So people take the MK7 to boost the levels of MK4 in the body more efficiently and by taking less of the material. Now, folic acid and B12 also have roles in calcium and magnesium metabolism. And vitamin B12 deficiency, along with folic acid deficiency, can increase homocysteine levels, which interferes with the way collagen is structured in the body and increases the fragility of bones. So B6, B12, and folic acid are all associated with protecting the collagen and the bone structures in the body. And body pH is important. I alluded to this earlier, but the acid-base relationship, the pH of what's happening in the bloodstream and the main part of the body is very important. Now, we're not talking about the kind of systemic acidity you can get from kidney failure or that kind of thing. This is not a disease state. This is simply an imbalance of the diet, and you're not eating enough whole foods that are more alkaline forming in the body, and that can make your bloodstream more acidic, which actually pulls calcium out of bones and tissues to balance the pH as best it can. So if you're not eating enough of the things that make the body as alkaline as it should be, then your body might become more acidic and strip calcium out from areas where it's needed. And it's not going to show very well in a calcium blood test because you're going to be pulling calcium out of other areas. It's not going to show how those are becoming deficient. So when the blood is too acidic, the calcium in the bones is pulled out. You can get bone loss over time. And when we're talking about acid or alkaline forming foods, we're talking about foods with certain characteristics. And this is somewhat counterintuitive because the alkaline forming foods are using weak acids to stimulate the production of alkaline compounds in the body. So foods that you would think of as being acidic, like fruits, are actually some of the more alkaline forming foods in the diet. So produce, fruits and vegetables, lentils and spices and herbs and seeds and nuts all tend to be alkaline forming, and acid formings would be a diet high in meats and fish and poultry and eggs, grains, some grains, not all, and legumes. So depending on the balance in the diet, you could be providing adequate alkaline forming compounds to the body, or you could be robbing the body of them. And processed foods is a big problem in terms of maintaining the healthy pH of the body. Now this chart is even more detailed. It's from the Alkaline Whey Guide from the Health Studies Collegium. Dr. Russell Jaffe prepared this, and he's one of the people who trained me on all this. My respects to him. So when you're looking at alkaline on the left and acid on the right, and the category in the middle, you can see that most categories have both acid forming and alkaline forming capabilities. Meat tends to always be acid forming, however. That's the one category that tends to be all on one side. Most grains are acid forming, but some of them, like oats and amaranth and quinoa, tend to be at least somewhat alkaline. So when you're making choices, like at the bottom, you can look at lemon as being low alkaline and lime as being most alkaline. If you use a lime in your water, you're actually going to make, it tastes acidic. It's tart, I know, but it does tend to make the body more alkaline because of its effect on the compounds made in the body. So this is a handy chart. If you go to honestnutrition.com, I have it posted there. If you do a search for alkaline or pH or any of these terms, you'll find it there. But Dr. Jaffe has created this wonderful chart. Now, for health maintenance, it's recommended that 60% of the diet be alkaline-forming foods. And for health restoration, it's recommended that 80% of the diet be these alkaline-forming foods. The alkaline-forming foods tend to be more supportive of the body, of healing, and less stress on the body than a high acid diet. And if you look at the far right column for the most acid, you'll find certain, fried foods, certain oils, certain grains, certain meats, even table salt. Sea salt, by the way, is way over on the left for most alkaline. Table salt that does not contain trace minerals tends to be the most acidic. So even a category like salt can have a wide range of effects. So diet is important, not just supplements. Eating a whole foods diet, eating a lot of produce and greens tends to allow your body to maintain its healthy balance of pH, acid, alkaline, acid base balance. And so these are essential nutrients. I take magnesium 3 times a day. I tend not to take calcium because I eat a dairy-rich diet, being a lacto-ovo vegetarian, that I'm eating a lot of dairy and tending to get a lot of milk and calcium. So I'm balancing that by taking more magnesium. Other people might have other dietary things. Most people do need to take calcium as a food or supplement. And magnesium tends to be in shorter supply in the diet because magnesium tends to be in whole grains, and a lot of people are not eating a mostly whole grain diet. So they're not only getting the acid forming compounds from the processed foods, but they're also lacking essential nutrients like magnesium in those kind of diets. So I hope this has been helpful in explaining different forms of calcium and of magnesium and some of the important cofactors, vitamin D and vitamin K, that are used, especially for bone health, but there's other factors. Homocysteine is not only a risk factor for bone density, but it's also a risk factor for cardiovascular health and brain health. So these things in the body that are undesirable compounds like homocysteine, if they accumulate, they can have multiple negative effects, and they're accumulating because of a lack of certain nutrients. So it's important to get your nutrients. I recommend most people take a multivitamin to cover those bases of the basic vitamins and minerals. You might not get all the calcium, magnesium you need in a multivitamin, but you'll get a little bit, and you'll get the other things. You'll get your vitamins A, B, C, D. You might take extra D, but you're certainly getting a base level, meeting the RDA. Some of the trace minerals, copper and zinc and those kind of things. So what I would suggest is look at your diet, consider taking a multivitamin, consider if you need calcium and or magnesium or vitamin D as supplements. And it's for certain diets, certain risk factors, vitamin K might be also advised. So with that, I'd like to thank you, and I'd like to thank the Natural Health Research Institute for allowing me to speak to you on this topic.